Hi, my name is Sydney Cooper, and I will be talking about the influence of counseling on the field of equine facilitated psychotherapy. Equine facilitated psychotherapy, or EFP for short, is defined as the interactive process between a mental health professional, an equine professional, and the client moving forward to accomplish a set of goals made by the mental health professional and the client. Horses are essential for this form of therapy because they are such sensitive animals and are able to pick up on different verbal and nonverbal cues that other animals are not. Some diseases and some disorders that are associated with this kind of treatment are anxiety, PTSD, depression, schizophrenia, and many other mental health disorders, as well as physical disabilities. Therapists are always present at each session and are able to open up lines of communication between the client and themselves throughout each session due to different activities being performed and allowing them to speak between themselves and the client about how that certain activity may make the client feel, or what kind of action is different from another and how that makes them feel as well throughout the session. Just some main points that I would like to cover throughout my presentation is the effect of the combination of counseling and EFP on the individual. Just some different techniques that are used throughout each of the programs. I'm going to be talking a little bit more specifically about widely used ones versus individualized, but I will mention some individualized ones as well. And just how this kind of therapy is more successful than other forms of rehabilitation or counseling, and why the combination is so important. So just kind of touching on the effect of the combination of equine facilitated psychotherapy and counseling has on the individual is that it fosters that kind of healthy relationship and the ability to build trust between the individual and the mental health professional, as well as being able to provide insight and instant insight for specifically the mental health professional and the client during that open line of communication throughout each session. And just also speaking about some techniques that are used throughout each session, a lot of times they will be using a little bit more widely used techniques as well as individualized techniques. A lot of times they are using consistent techniques to not only benefit the individual but benefit the horse as well. And then many equine facilitated psychotherapy programs will use horses that have those same diseases or those same disorders to better build a bond between the individual and the horse, such that like maybe a horse with PTSD will pair well with a person with PTSD versus just a normal therapy horse doing that as well. And then some sessions may not even include direct contact between the individual and the horse. A lot of times they will focus on the nonverbal cues that are passed between the two to better establish that relationship and better establish why this horse is acting a certain way because I'm feeling a certain way, and allowing that individual to become more aware of their emotional state and their physical state. And also just speaking about just some specific therapy techniques. One is cognitive therapy, which is used more for people with anxiety, and is able to better facilitate the responses an individual may have in an everyday position, an everyday situation, and how they can better judge, should I be acting this way or should I be responding that way, or is this a better way? They also use some practicing activities. People with severe anxiety are more focused in this form of technique just because they like to use activities that aren't going to put that person in a super stressful situation. It's a little bit more comforting, a little bit more calm of a situation. They're bathing, they're brushing, just something that really doesn't take that much cognitive ability, but they're able to facilitate their thoughts as well. Also, activity scheduling is important, being able to create a consistent schedule throughout the week, making sure that activities are being completed, 1 or 2 a day or just specific ones on each day. And also, last but not least, play therapy and storytelling are really important, especially with children with these kind of disorders, just because it encourages them to access their creative ability while also participating in these activities. It allows them to really kind of think through in an imaginative sense what they're going through on a daily basis within their disorder. All right, now transitioning into why this combination of EFP and regular counseling is more successful than other forms of therapy and rehabilitation. Just how that this form actually, compared to other forms, allows the individual to become a little bit more aware of themselves, aware of what they're doing, what they're thinking, what they're feeling, because the horse emulates that throughout the entire session. They pick up on it and they end up sort of mirroring it to the person, and they actually get a better sense of, you know, wow, I'm feeling anxious and so is this horse, like I should really just take a breath and calm down. And also like how moments of frustration and moments of tension can actually really facilitate the conversation between the mental health professional and the client, and how they can really get down to the deeper issue of what is going on in my life and why do I feel this way at this present moment. And also just like focusing specifically on the influence of nature in these programs versus others, the ability to be outside and be in a different element and also be in a more comfortable element compared to other spaces where you might, or other programs where you might be in an office or you might be in a facility for physical therapy, just different stuff like that where you can be outside in an open area where you can interact with horses and interact with other people. It really facilitates a positive environment. And just going off of a quote that I got from Carissa Brandt, she says, through attending to and validating the horse's nonverbal cues, clients can gain a better awareness and understanding of their own bodies. Often individuals with mental illness, such as the individuals that participate in this kind of program, specifically those suffering from trauma, eating disorders, or SUDs, feel disconnected with their physical bodies. EFP sessions help clients to reconnect with their bodies, so it helps them to be a little bit more aware of what is going on with them. And then participating in equine activities, particularly when outdoors, also encourages the use of both verbal and nonverbal communication, as clients need to maintain awareness of themselves in the relation and their surroundings. And that was also from Carissa Brandt. But yeah, that's basically the position that I would like to go in for the rest of my life. It's a really near and dear to my heart, and I hope you guys are interested. And my next slide is just a couple pictures that I really liked, that I thought really truly represented equine therapy as a whole. So I hope you enjoy them, and I hope you enjoy my presentation. Thanks.